Okay, today's class we'll be doing on non-metallic chemical poisons. Okay, so basically we'll be covering phosphorus. Okay, so phosphorus actually is a Greek word and it means light bearing. Light bearing, why? Because it catches fire easily. Okay, that's why it's called as light bearing. So there are various types of phosphorus. Okay, so yellow or the white phosphorus, red phosphorus, black phosphorus. So the most important one which we'll be learning is the yellow or the white phosphorus. So why is it important? The yellow or the white phosphorus is highly combustible, means it catches fire easily on exposure to air. Therefore it is usually stored in underwater. Okay, it's stored in underwater. It's yellowish, waxy crystalline, and it's usually garlicky smell. It's highly combustible, as I said, and it glows. It's luminescent, that means it glows in the dark. Whereas the red phosphorus or brown phosphorus is usually odorless, that means tasteless, and is relatively harmless. It's not absorbed by the GI also. The black phosphorus is inert and non-toxic allotropic form of elemental phosphorus, and related compounds of phosphorus are aluminum phosphide and zinc phosphide. Okay, these aluminum phosphide and zinc phosphide is important. I'll tell you in the next slide where do you find these. So here are the images of yellow phosphorus and red phosphorus. Okay, the yellow and the white phosphorus, as you can see, is stored in water because it's highly combustible. On exposure to air, it oxidizes easily and to form phosphorus pentoxide, and it usually catches fire. Therefore, it's stored underwater. The red phosphorus, as you can see, is usually inert or harmless. Okay. So what are the uses of this phosphorus? So uses, you can see mainly 5 uses are there. Matches, it's used in, but today nowadays in safety matches which does not catch easily fire, the matches do not catch fire on exposure to air. It usually contains, nowadays the matches contain potassium chlorate and antimony sulfide, and the sides of the box being coated with powdered glass and red phosphorus. Okay, so these are the, earlier it used to be like this, it's called lucifer matches. Phosphorus is highly combustible, as I said, that's yellow phosphorus, that's why it's used in fireworks also. In military uses, the yellow phosphorus is an ingredient of tracer bullets. Incendiary bombs means bombs which catch fire easily. Smoke screens and air sea rescue flares. Okay. Now coming to zinc phosphide and aluminum phosphide. Zinc phosphide is usually seen in powder forms. Okay, it's used for killing cockroaches and rats, and fertilizers mainly contain aluminum phosphide. So coming over to the fatal dose. The fatal dose of phosphorus is usually about 60 milligram. It's roughly about 1 milligram per kg body weight. Okay. So a 60 kilogram person will, for the 60 kilogram person, a fatal dose is usually around 60 milligrams. So mode of action. The yellow phosphorus is a potent hepatotoxin, means it attacks the liver. In large doses, it can cause shock, cardiovascular collapse, since it's also toxic to the heart. Okay, on when it comes in contact with the skin, it produces severe irritation, and the rate of absorption is greatly increased if phosphorus is administered in an oily vehicle. Okay. So what are the clinical features of phosphorus poisoning? So phosphorus poisoning may be divided into fulminant poisoning, acute poisoning, and chronic poisoning. So fulminant poisoning is if a massive or high dose is taken. Usually if it's taken like 1 to 2 grams, the dominant clinical pictures of peripheral vascular collapse and death occurs instantly within 12 to 24 hours. Okay. Acute poisoning. The most cases of phosphorus poisoning falls under acute poisoning. So here the stages are the first stage, second stage, and the third stage. So what happens in the first stage is, as phosphorus has a garlicky smell, there's a breath smells of garlic, and in contact with the skin, as I said earlier, it produces irritation. There may be pain, burning, vomiting, diarrhea, and abdominal pain. The vomitus and the stool may be luminous in the dark. As I said earlier, it glows in the dark. There may be hematemesis. Okay, faint fumes may emanate from the stool. Smoky, that is called smoky stool syndrome. Now, in coming to the second stage, that is several days after the first stage. So, first stage is only up to 3 days. Second stage is that after 3 days. In second stage, what happens is the essential symptom-free period is there in the second stage. So coming over to the third stage, that is after the several days of second stages. Here in the third stage, the phosphorus is completely absorbed by the body. So systemic effects is the main thing you'll see, and it usually affects the, as it's a hepatotoxin, it usually affects the liver, leading to jaundice. Okay, there may be pruritus, bleeding from multiple sites. Finally, hepatic encephalopathy. Okay, characterized by drowsiness, confusion, ataxia, tremors, stupor, coma. At this stage, there is mousy order to the breath. Okay, fetor hepaticus. So all the features of liver failure will be seen. Now, once there is liver failure, it will proceed further to the damage of the kidneys. Okay, renal failure leading to oliguria, hematuria, albuminuria, and finally acute renal failure. So there will be ECG changes also. Okay, you usually see tachycardia, ST and T wave changes. QT prolongation will be there, low voltage QRS, and various arrhythmias. Okay, the rhythm will be changed. So there may be terminal convulsions before death supervenes, and early hypoglycemia has a grave prognosis. Survival for 3 or more days is a good prognostic sign. So in third stage, all the systemic effects, all the organs are affected, mainly the liver, the kidney, okay, the heart. So as I said earlier, how do you diagnose case of acute poisoning? So whenever there is any case of phosphorus poisoning, you always remember there is garlicky smell, luminescent, and hepatotoxin. These I said several times earlier also. So these three things. Then you add renal failure. There may be hypokalemia, hyperchloremia. Obviously, when the liver is deranged, okay, liver function is deranged, the kidney function is deranged. So all the serum electrolytes will, there will be difference in all the serum electrolytes. There's hypokalemia, hyperchloremia, hyperphosphatemia, hypophosphatemia, okay, hypoprothrombinemia, and thrombocytopenia. Because of this, there is hematemesis. Okay, now dermal contact also, as I said, any contact with the skin or the mucosa will lead to severe irritation of the skin. Okay, there will be corrosion. Okay, so severe painful second or third degree burn, okay, like features will be there with garlicky odor. Then there may be absorption of this phosphorus from the damaged skin, resulting in acute systemic phosphorus poisoning. Now that we have completed chronic acute poisoning, we'll come over to chronic poisoning. So what happens if there's chronic poisoning of phosphorus? This usually terms from, it usually happens in long-term occupational exposures to fumes of phosphorus pentoxide, and it forms, as you can see in the picture, it forms a condition called phossy jaw or glass jaw or Lucifer's jaw. So what happens is, the main feature there is usually, okay, the main features include, as you can see in the jaw, there is a, main features are toothache because of recurrence. These toothache must be eventually be followed by extraction of the tooth. They will lead to, they will be leading of severe exposure of the bone. There will be necrosis, sequestration, and osteomyelitis, means degeneration of the bone, mainly the lower jaw. Chronic exposure to red phosphorus or phosphorus sequestrified may cause dermatitis. Okay, so as you in contact with the skin, it causes irritation, may cause dermatitis. So how will you treat a case of phosphorus poisoning? So whenever in case of any poisoning, we usually start with gastric lavage. So in case of phosphorus poisoning also, acute poisoning, gastric lavage with potassium permanganate, okay, this which oxidizes the phosphorus into relatively less toxic form of phosphorus acid and phosphates. Now we should not give any milk or oily or fatty food. As I said earlier, this will increase the absorption of phosphorus. Okay, so to control hematemesis and bleeding, we give vitamin K by IV drips, 65 milligrams slowly. Okay, this controls the hypoprothrombinemia. Intravenous fluids will be given to, like isotonic saline and sodium lactate, to treat any cause of shock or dehydration. So since the patient is having hypoglycemia also, the glucose, we should compensate with glucose. For hypocalcemia, we should give calcium gluconate. To prevent these coagulation defects, we should give whole blood or fresh frozen plasma. Steroid and inotropic support can be given for shock. Anticonvulsants can be given for seizures. So mainly these all are symptomatic managements. So for the treatment of dermal burns, how will you manage? So in any case, it's very similar to fire injury or burns caused by fire. Okay. So here the initially what we do is flush with large. We put large volumes of water. We remove any kind of residue or phosphorus on contact with the skin. We clean the wound. Okay. We disinfect it with water and with soap. That prophylactic topical antibiotics can be given. Usually in case of burn also we give sulfadiazine is recommended. Okay, for all except superficial partial thickness or first degree burns. Okay, so deep burns, depending upon the site and the area the burn may be treated. Okay, for face, ears, perineum, or covered with sterile non-stick porous gauze. Alternatively, a petroleum fine mesh gauze may be used alone for partial thickness. Analgesics like paracetamol or codeine may be given to get relief from the pain. Phosphorus particles in dermal burns can be usually visualized by use of Wood's lamp. They glow in the dark. Okay, phosphorus which will fluorescent under ultraviolet rays or ultraviolet light. So now coming over to chronic poisoning. So what will happen is, what we'll do is we will remove the patient. Okay, so we'll remove the patient from the source of exposure. Dental treatment and follow-up should be done. In case there's death due to phosphorus, what are the features you'll see on autopsy? Garlicky smell, jaundice, as I said earlier. Bleeding points, there'll be various bleeding points from subcutaneous hemorrhages. Since it's luminant, the gastric contents will be they'll be fluorescent on UV light. Congestion and inflammation of the skin and mucosa. The liver is affected, obviously, as it's a hepatotoxin. There's evidence of yellow atrophy. There may be fatty degeneration of the heart and the kidneys. So all the viscera must be kept for analysis, okay, and must be preserved in saturated saline or rectified and not rectified spirit. Otherwise, the luminosity, especially of the stomach contents, will be lost. So it should be kept in saturated saline. So coming over to the forensic issues, since phosphorus is the poison, is usually related to poisoning, so it may be accidental, suicidal, or homicidal. Earlier, what used to happen, it used to be very common in cases of accidental poisoning because of unrestricted use of phosphorus in matches, fireworks, cockroach or rat poisons. But now we have these safety matches in which potassium chloride and antimony sulfide has replaced this phosphorus. Okay, so it's much more safer. Suicidal poisoning also was previously quite common in Western countries because of in Western countries. Today, now rat pastes containing phosphorus are occasionally implicated in suicidal ingestions. Okay, there are various other poisons. So for homicidal poisoning, formerly phosphorus was quite frequently employed for committing murder, but now there are various other poisons which is usually undetectable. So they prefer that in cases of homicidal poisoning.
Hello everyone! Today I want to tell you about such an element as phosphorus. Phosphorus is a typical non-metal element that is located in the 15th group of the periodic table of chemical elements. In nature, phosphorus is present in the composition of the minerals called apatites. Our body contains 1% of phosphorus by mass, mostly as a part of the bones. Pure phosphorus exists in 4 allotropic modifications, the most common one of which is the modification of red phosphorus. The red phosphorus looks like a dark red powder, which readily absorbs moisture from the air. Over time, red phosphorus gets caked due to formation of polyphosphoric acids while being exposed to air. In everyday life, we can find phosphorus on the scratched surface of a matchbox. During the friction process of a match with the box, the potassium chloride contained in the match head oxidizes the phosphorus, releasing heat that ignites the composition of the match head. Red phosphorus burns well in air. And of course, it burns even better in pure oxygen. In a flask filled with pure oxygen, the burning phosphorus emits huge amounts of light. This reaction can be used for lighting up a large space. The smoke produced in the bulb is nothing more but the phosphorus oxide, from which is possible to obtain calcium zinc phosphate, which is used for coating the insides of fluorescent lamps as luminophore, in addition to the red form, which is more or less stable. By a process of sublimation, the red phosphorus can be converted into a very unstable form, the white phosphorus. White phosphorus has more interesting but dangerous properties. For example, its extremely high toxicity. In air, white phosphorus actively oxidizes and releases smoke, forming the oxide of phosphorus. Hence, it's stored in water. In the dark, white phosphorus glows due to oxidation by oxygen in air, but the glowing is very weak. But you shouldn't think that everything that glows in the dark is phosphorus. No one is going to sell toys made of white phosphorus and cause the clock hands using it. If you are doubting this, look at what happens when the white phosphorus is put onto a warm surface. It immediately melts and ignites, burning with a very high temperature, more than 800 degrees Celsius. White phosphorus burns on any surface, igniting everything around it. That is why people started to use it to make incendiary ammunition shells, which later got banned by the Geneva Convention. White phosphorus is highly soluble in some nonpolar solvents, such as benzol and carbon disulfide. In carbon disulfide, the solubility of white phosphorus is the highest. If you immerse paper into such solution of phosphorus in carbon disulfide, you'll see an interesting effect. Over time, the carbon disulfide evaporates, leaving a fine white phosphorus, which will then spontaneously ignite and burn the paper. According to some skeptical scientists, exactly this reaction is used as a demonstration of the phenomenon of virtual fire in Jerusalem. Also, the solution of white phosphorus in carbon disulfide was used for the self-igniting Molotov cocktail during World War II. These are two more forms of phosphorus show, black and metallic phosphorus. However, unfortunately they are very difficult to find, especially getting hands of them for conducting experiments. Nowadays phosphorus is used in agriculture as a fertilizer, for water softening and for protection of metals from corrosion. Also, phosphorus is part of the most dangerous toxic nerve gas on the planet, the usage of which is prohibited. Now you know a little bit more about one of the other metals. If you would like to support the continuous production of science videos like this one, please support channel on Patreon, link in the video description. Please like this video and subscribe to my channel to see many more new and interesting.
So these are phosphorus compounds, aluminum phosphide. These are usually used in fertilizers as fertilizers or grain preservatives. So aluminum phosphide, also known as alphos, cellphos, phosphotoxins, quickphos, these are usually available as small tablets, grey tablets of 3 gram each, mixed with urea and ammonium carbonate. And I said earlier also, these are usually grain preservatives. So here there is a, you can see quickphos, this aluminum phosphide. Okay, so these are usually grain preservatives. It will look like this. So this is what aluminum phosphide tablets look. Each tablet is about 3 grams, and I said earlier it's usually mixed with urea and ammonium carbonate, used as a grain preservative. So mechanism of action, you have to remember, the main mechanism of action is when aluminum phosphide comes in contact with water, there is formation of aluminum hydroxide plus pH3, that is phosphine. This is the main thing or the main poison. This phosphine inhibits the enzyme cytochrome oxidase. Okay, so whenever there is any kind of poisoning due to aluminum phosphide, the clinical features are metallic taste, vomiting, garlic odor. This garlic odor I have said it several times, please remember. Intense thirst, burning, epigastric pain and diarrhea. CVS means cardiovascular system, hypotension, tachycardia. ECG, sinus arrhythmia, congestive cardiac failure. Okay, myocardial injuries, hepatic injuries, damage or renal failure, respiratory distress, convulsion and coma. So these clinical features are similar to all kinds of phosphorus poisoning. So again the same thing. How will you diagnose? Garlicky odor, hepatotoxin. Therefore liver function test abnormal, urine analysis, blood urea and serum creatinine high means kidney failure is there. Hypo and hypermagnesemia and phosphatemia. Serum electrolytes all have changed. ECG changes will be there. Okay. QT prolongation will be there as I said earlier also. So there are various other tests like qualitative tests or breath test. Okay, so this filter paper impregnated with 0.1 and silver nitrate, and whenever this filter paper comes in contact with phosphine, there is blackening of the paper. So second is biological tests. So in case of aluminum phosphate poisoning, what will you do is treatment is MSS is not to be MSS not to be induced. Okay, stomach wash preferably not done. The shock dopamine, in shock we give dopamine. Respiratory distress should be treated. Metabolic acidosis we give sodium bicarbonate. Convulsions should be treated, and for cardiac arrhythmias we give magnesium sulfate. So the autopsy features are widespread hypoxic organ damage, hemorrhagic content of stomach with intestine and Gallici order, necrotic changes in liver and kidney, toxic myocarditis and fibrillar necrosis, and lungs with acute respiratory distress syndrome. Now coming to the other compound, that is zinc phosphide. So there are only two compounds which you need to remember: aluminum phosphide and zinc phosphide. Aluminum phosphide is a grain preservative or mainly used as fertilizers, and zinc phosphide is usually as rodenticides or to kill rats. Okay, so these comes as agrophos, commando, sudarshan, ratol, ratoff. These are all brand names. So they are dark gray tetragonal crystals usually used as rodenticides. Fatal doses are around 2 to 4 grams. The mode of action is same as aluminum phosphide, that is production of phosphine gas, and medical legal importance is usually accidental or suicidal poisoning. So as you can see in the image, rat, so it's usually used as rodenticide. On the right hand side you can see ratol is the zinc phosphide, and it's usually mistaken with toothpaste like close up and all, so mainly in kids, therefore accidental poisoning usually happens. So lastly I would like to summarize the whole presentation. Okay, so summary is yellow phosphorus is usually more dangerous than red phosphorus. Is usually combustible, therefore it's kept underwater. Okay. Lucifer matches and phossy glow is usually seen in yellow phosphorus. As I told you, what is phossy glow? There is necrosis or osteomyelitis of the jawbone, especially the lower jaw. Okay, so red phosphorus in rough surface of matchbox. Red phosphorus usually, where do you see it? On the rough surface of matchbox. Yellow phosphorus is combustible in air, therefore kept in water. Yellow phosphorus in air forms phosphorus pentoxide, that is usually ignitable. Yellow phosphorus is luminescent, that means it glows in the dark. The fatal dose of phosphorus is usually 1 milligram per kg body weight. It's a hepatotoxin. It affects the liver, it affects the kidneys, it affects the heart. The treatment is lavage with potassium permanganate. Aluminum phosphide and zinc phosphide are the two compounds. Aluminum phosphide is an insecticide and zinc phosphide is a rodenticide. The mechanism of action is the same. Usually that's release of phosphine gas. Okay, and you can usually test it with the breath test, in which zero point 0.1 and silver nitrate is filter paper is used, which turns black on contact with phosphine gas. So that's the end of the class, and if you have any doubts, you please you can ask me anytime.